Hi, I'm Stephen Grover. It's a pleasure to speak to you today on our recent study looking at online health promotion for Canadian veterans and their families during the pandemic. A couple of quick disclosure slides. It's important to note that the Mission VAB program was funded by a grant from the Veterans and Family Wellbeing Fund, and I'm a principal of Clinimetrica Inc., which received the grant, and I'm also a founding director of the McGill Comprehensive Health Improvement Program, where the Mission VAB content was developed and pilot tested. All data was self-reported and collected online directly from study participants. Our learning objectives today will be to understand how an online health promotion program impacted veterans and their family members during the pandemic. And we're also going to compare the results to other Canadians who used the program at the same time. I provide some references in case you want to check out some of our work. Let's get started here. As many of you know, Canadian veterans and family members often suffer from a number of health issues compared to other Canadians, including chronic pain and a number of mental health problems. Most recently, this is a study that hasn't yet been published, a survey was done of the well-being of Canadian veterans during the COVID-19 pandemic. Importantly, 56% were feeling worse, 30% no change, and only 4% were feeling better. This sets us up for an opportunity to see if we can make a difference with an online health improvement program. Web-based programs may improve lifestyle habits if they can be proven to be engaging and effective. And unfortunately, high dropout rates are very common. This is perhaps best represented by a recent effort by U.S. Veterans Affairs, where they developed a COVID coach app. They released it in 2020. It provided 13 digital health interventions to support veterans' health. And during the first 4 months, over 49,000 individuals downloaded the app. Unfortunately, 49% used it only once, and less than 2% used the app for 15 days or more. I'm pleased to say our colleagues in the United States published their experience, and this information is very helpful in those of us who are trying to improve health through the digital health space. Social isolation measures associated with the pandemic negatively impacted the health and lifestyle habits of Canadians, including stress, sleep quality, healthy eating, weight management, and physical activity. An online health promotion program that had been started in late 1990 preceded the pandemic, and we opened it to all Canadians during the pandemic in March 2020. This provided us with an opportunity to compare the results of other Canadians to the veterans and their families. This program was developed to help veterans and their families adopt healthy lifestyle habits, connect with peers, and have fun participating in online health missions. We evaluated the impact of sequential 6 to 10 week missions on self-reported metrics, including stress, sleep quality, fatigue, mastery, loneliness, daily exercise, and weight loss. During the 12 pandemic months, starting in March of 2020, regular missions were provided to registered users, including 3 homebound resiliency missions, 1 Buns of Steel mission to build up muscle strength, a family summer fitness program last summer, a Healthy Heart mission during Healthy Heart Week, 2 Drop 5 weight loss missions to help people lose weight, plus a Pirates and Privateers exercise challenge, which just provided a lot of fun around Stan Rogers' song, Barrett's Privateers. And then this past summer, a Push Past the Pandemic mission to get older individuals involved in recovering from the pandemic, a Zen mental health mission, and most recently now we have an online Eat Well mission that's occurring as we speak. The program design focuses primarily on gamification and social connectivity, and these are used to drive participant engagement. These include health assessments at baseline and at the mission completion, behavior tracking, leaderboards, daily health tips, and a message board. So you can see here how someone could be tracking their mood, stress, resilience, sleep. They could be comparing how their team is doing to other teams. They're getting a tip of the day. They're making note of what they're doing each and every day. And last but not least, they're posting information to their team wall, the mission wall itself, or a wisdom wall where they share reflections on what's worked best for them. Daily exercise was digitally tracked and are self-reported. They could do this with their smartphone or a digital tracking device. Weight was tracked weekly, and mental health metrics were assessed using validated tools such as the perceived stress score, the insomnia severity index, etc. Here you see an example how they can enter steps manually, or it can be tracking on their Apple device in this particular case. Steps, calories, minutes of exercise are being tracked. And if you're watching your weight, week by week, they're tracking their weight as an example. Let me show you the results of the first 434 participants. The average age was 49. 64% were female. Half were veterans, family members, and supporters. The other half were non-veterans. Nearly 60% participated on a team. The rest participated individually. I'm going to talk to you a little bit more about health coaching in a minute. 50% received health coaching at some point during their mission. 25% included their dog on a pet leaderboard, which I'm going to show you in a minute. And 64% completed at least one mission. 27% dropped out on average during any one mission within 2 weeks. Excuse me, and that's a pretty favorable dropout rate. Most online programs see at least 30 to 50% dropout within the first week or two. Many don't get past 30% completion rate. At the end of 6 to 10 weeks, depending on what they were doing, this is the data for 327 individuals. 44% exercised the equivalent of 10,000 steps or more a day. That's the equivalent of walking about 5 miles daily. Among those who were in the Drop 5 mission and trying to lose weight, 40% lost at least 5 pounds over 10 weeks. Stress levels improved by at least 20% in 53% of participants, and sleep quality improved by at least 20% in another 49% of participants. If we compare veterans and their family members to other participants, you can see the results are very similar. Approximately the same age, 2/3 to 80% were female. On average, our participants were overweight or obese. Insomnia severity scores were elevated, as was perceived stress scores, as was general fatigue, and the completion rates were about the same. About 64 to 68% got through 4 weeks in the mission. Drop in stress was 14 to 19%. Improvements in sleep, 9% for the veterans and family members. Sleep actually got worse in the other group by 3%. Drops in fatigue of 12 to 13%, and on average, people were exercising approximately 11,000 steps a day, which is incredible. One of the things we've learned in this particular mission was tracking really supports behavior change. This has been proven by others, but we also have found that if you want to change something, track how you're doing. And that can be measuring your weight once a week, or tracking your exercise daily, or looking at what your sleep hygiene habits are every night that you go to bed. And making it easy was a very important part of the tracking exercise. Engagement supported using mastery, social connectivity, and gamification. Very, very important. Here's the pet leaderboard, which we introduced about midway through. In our most recent mission of just over 400 people, we actually had 149 pet users who posted their pets up on the leaderboard. That included 141 dogs, 3 cats, and somebody posted a guinea pig as well, but I can't understand how the guinea pig exercised on a daily basis. Health coaching also made a difference. During the pandemic, we reached out to volunteer students, both psychology students and medical students. And we taught them how to become health coaches by monitoring online activity of the participants and once a week sending them an email to reflect back on what they were doing, how they were reaching their goals, and of course, picking up on anyone who looked like they were dropping out. Early dropouts declined significantly from 9% to 7% with health coaching, while participants remained in the mission 36% longer, an average of 49 versus 36 days. Daily exercise also increased by an additional 20%. Despite the restrictions imposed by the pandemic, an online health promotion program developed for veterans and their families was associated with improvements in lifestyle habits, measurable health benefits, and building community. For us, the remaining challenge for the next 2 years is how do we scale this up and reach those veterans and family members who would benefit the most from engaging with their colleagues while improving their healthy lifestyle habits. While we saw lots of improvement in mental health metrics, exercise habits, and weight loss, it's clear to us that our participants do not represent those who have the greatest problems in the veteran community. 60 individuals did have mobility problems, and some were wheelchair bound, and I think that's great that we were able to reach those individuals. But one of the things we're looking for in the next 2 years is going to be how do we get to the veterans that can benefit the most? And that will include individuals with chronic pain, mobility issues, those who are using medical cannabis to treat unmet medical needs. All right, this will be an interesting journey. We look forward to collaborating with any of you who are interested in this project, and I thank you for your attention.